This week, we are receiving a total of 643,000 doses of Pfizer and Moderna vaccines, the largest shipment to date.
And so, with more vaccines on the way for Canadians, many provinces and territories are planning to begin vaccinating seniors living independently in the community. Saskatchewan, Nova Scotia, and Prince Edward Island have already started. Alberta will be providing vaccines for seniors 75 and older starting tomorrow. And Ontario hopes to vaccinate people 80 and up in the coming weeks. So we heard from many seniors who had questions such as how these vaccines perform in older people, how they'll know it's their turn to get the shot. So to help us answer some of those questions, we're joined now by Dr. Samir Sinha, the Director of Geriatrics at Sinai Health System in Toronto, and Dr. Maria Chang, a geriatrician based in Vancouver. Thank you both for joining us. Let me start with you, Dr. Chang, if I may. You are a geriatrician who does visits with seniors in Vancouver, and I'm curious what concerns you about them right now.
Yes, I spend 3 half days a week doing visits for homebound seniors who need geriatric consultation. And they have really taken a hit this year, physically, mentally, emotionally, and their caregivers as well. So 70% of care in the community is provided by family caregivers. So those are friends and family. And they have been quite overwhelmed by the care needs of their seniors who now cannot go out. The community centers are closed. The adult day centers are closed. A lot of them have dismissed their homemakers because they're afraid of COVID coming into the homes. And they're very, very, very distressed at this point in time. And I think that anything that can be done to help them, including the vaccine, I think will be very helpful.
When it comes to the vaccines, you know, we understand that some seniors may face challenges in getting them. We had this question sent to us. Have a listen.
I'm not able to get out to a clinic for this vaccination, and I wonder if there's been discussion about the local health authorities being able to send a healthcare professional to the home to do a vaccination.
So this is a question for British Columbia. So Dr. Chung, again, to you, if I may, is there a plan to make vaccines more accessible for seniors in BC?
So if you are known to the health authorities, so in other words, if you are getting home care and you are a housebound senior, there is a plan to have nurses bring the vaccines to people's homes to give the vaccine, which is really good news. My concern is what will happen to those homebound seniors who are not receiving public health services, but may instead be getting them from families or from private pay home care. I'm not sure how they will be included in this, and I don't know how they're going to be able to find everybody, because obviously some seniors, if they're hearing impaired or they're not computer literate and are not on the internet, I don't know how they're going to reach out to them, because as you know, not all seniors have family physicians.
Well, Dr. Sinha, let's talk about that, because there are seniors who may not, again, have access to the internet or be able to call to book an appointment to get a vaccine. In Ontario, what is the plan to reach those people?
Well, right now in Ontario, they're looking at having the 34 public health units, create local strategies and plans. So we've heard about a website and a phone line that will be launched. But really, when it comes down to many seniors, many don't actually have primary care providers or are homebound and can't get out to a mass vaccination clinic or even to a local pharmacy. And so we're going to be using a same strategy that for those who are known to the home care programs, we usually will use paramedics and other professionals and community nurses to get into the homes to vaccinate them. And we're hoping to create similar systems for other people who are homebound, who wouldn't readily be able to access a vaccine, because the sooner we get the most seniors vaccinated, the better we're protected and the better we all are.
Yeah, this is urgent. We've had a lot of questions about the safety of vaccines for older people. Here's one of those.
Hello, my name is Kelly Ip. I live in Vancouver and I just turned 80. So I look forward to getting my shots within next month or two. But some of my friends who are in their 60s and 70s are a bit reluctant to do so. They worry about there may be side effects. So how can we convince them that it's fine, it's okay to get the shots?
Dr. Sinha, how safe are these vaccines for seniors?
The good news is these vaccines have now been tested and evaluated through Health Canada. They have very stringent standards. No methods were actually cut along the way to try and actually to fast track these vaccines. These vaccines have been found to be incredibly safe, and the great news is that now that most of the seniors in England, most of the seniors in Israel have been vaccinated, we found these to be incredibly safe. And the good news is actually that side effects that usually occur in younger people are not occurring as often in older people because their immune systems can't usually mount a strong enough immune response around the side effects. However, they're still showing about a 95% effectiveness in seniors. So they're getting the benefit without necessarily the same level of side effects, which is the best news of all.
And Dr. Chang, how are you approaching seniors who might be hesitant to get it?
So I think trust is really important. If they have a family physician who can speak with them or people that they know and trust, that's very important. So relationship building is obviously helpful. The other thing is that I use examples. So there is a nursing home that I am affiliated with, and they have had 90% uptake of the vaccine with no significant side effects. And the other 10%, they were just waiting to see what happened with the 90% that got vaccinated. And since they had no side effects, they are now, now they are going to go forward with it. But we do have to be very sensitive to the effects of different racial groups' experience with the vaccine. So in Vancouver, a lot of the Philippine community are very suspicious of vaccinations of any kind because of a bad experience that happened years ago in the Philippines. So that is something we have to be very sensitive about.
Dr. Chang, Dr. Sinha, thank you both so much for joining us. Obviously, we couldn't get through all the questions. So for more answers from the doctors, follow us, please, on Twitter at CBC The National.